once an Omicron wave hits Singapore within a couple of weeks.
I've never expected that in my life I would go through two pandemics, one the SARS in 2003 and now the Covid-19.
Experts have said that the next 2 weeks are crucial in our coronavirus battle as we enter a new phase of community transmission.
I got infected by COVID. It deteriorated very fast. I'm supposed to be dead.
Each time we tighten up, businesses are further disrupted. Workers lose jobs.
Some days where your sales is zero, you will definitely have a breaking point.
It's been a long campaign against COVID. The war continues. But we are in a much better position now.
Okay, how are you feeling now? Okay, that's good. I do not know whether you have received a message, but I thought I'd call you to let you know that your PCR test is positive. So you got confirmed COVID. Let me just have a look at your result. I'm Dr. Dale Lim from the Tenteram Clinic at Whampoa. I'm a family physician of 20 years. You need to stay isolated in your own room and don't go out. Okay, and make sure the room that you choose preferably have attached toilet so you don't have to get out of the room frequently. On an average day, I have about 6 to 8 new patients with COVID infections. When I had to break the news, it is oftentimes very difficult for them because they would then think of whether they would get a severe illness and how it would impact on their loved ones within the household as well as their friends. When the news of the coronavirus outbreak happened early 2020, I had a flashback to the posting I had in Tan Tock Seng Hospital during 2003 when the SARS outbreak happened in Singapore. SARS virus was lethal. The question was then, is this virus as lethal as SARS? We had to adapt. So we quickly shifted our flu consultation area outside in the ventilated area. This is to minimize the risk of having a patient with COVID step into the clinic. In addition, my staff had to spend additional time to sanitize the clinic, prepare the clinic so that we can resume our normal clinical services. We took out our N95 masks, our gowns, our gloves, and our face shields in the event that any of our staff would have contacted a patient with COVID-19. Tickle, tickle like that. Tickle, 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 tickle. In April 2020, we stood up the swab and send home capability. This allowed me to provide swabs and laboratory support to confirm COVID cases. Very, very good. You just press here if you can.
Okay.
Yeah, you're going to keep your card first. Yeah. Yeah. So for half an hour, we need to observe you for a while. Yeah. And make sure you're okay before you leave. Okay. All right.
Thank you.
You're welcome. To me, the vaccines was a turning point in the fight against COVID because it is able to limit the transmissibility of the COVID virus infections within the community. At the same time, also prevent or reduce the ill effects of the virus and reducing mortality. So we give it intramuscularly. So now, have you all broken the ampoule before?
Yes, we are trained to do it.
Have you done it before?
Yeah, in school.
Okay, never mind. Who wants to do it? This is a good opportunity, but don't injure yourself now. The key is the dot here. The most difficult thing for me was whether I would bring the virus back home because I have a wife and a young son. Oftentimes, as this virus cannot be seen, you do not know whether you're carrying it. Okay, this is quite easy. We have seen that during this pandemic thus far, many countries have resorted to school closures, keeping children at home to minimize spread of COVID. I will look back on how I've managed to send my son to school pretty much every day of 2020 and 2021. I was also very reassured that the school was well controlled. There were safe measures in place such that my son could go to school and not have his education interrupted. Not many people appreciate it, but I think that is very key, It's not an easy pandemic to manage. One would have to balance managing the community cases, preventing infections in the community, as well as ensuring that there's little interruption to social activity as well as economic activity in the country. Initially, I was hopeful that this virus could be contained like the SARS outbreak in 2003. But however, this virus mutated. The Delta strain did make it more transmissible. affecting more people, making it harder to contain.
As cases grow exponentially, the number of serious cases will also grow in step. And when the number of cases grows very large, even 2% of a very large number will translate to many patients needing hospital and ICU beds. Our healthcare system would rapidly be overwhelmed.
I was hesitant about getting the vaccine because I have severe allergic reactions. My husband also has a little bit of hypertension and allergies. Then we realized there are other vaccines that are protein-based, the Novavax that's coming up. We thought that would be quite good. So that's why we thought we will wait for that. My husband went for the vaccination early September. I was supposed to take the vaccination just before I got sick. I keep telling my husband that I was very tired. He brought me to the clinic. I was already perspiring a little bit. I was showing signs of breathlessness and the blood pressure was dropping to a dangerous level. So they insisted on having the ambulance send me to the hospital. And I can still recall reaching the hospital. Every time I open my eyes, I see nurses running around, quite panicking. The next thing I remember is people in spacesuit, and it seems like they are transferring me to another place. Only after I regained consciousness, then I realized I'm in another hospital, in NUH, and in the ICU. And I was pretty in very bad shape. I can see lots of equipment, a lot of tubes, a lot of drips. Yeah, it was quite scary a little bit, but I tell myself no point being in a panic. Actually, my husband was very worried, but he didn't tell the kids. So my husband was the only one taking the stress. When I did the first video call with him, he was very happy. He was telling me the updates of the house and all. But at the end of that call, I can actually catch him shedding tears. After ICU, movement-wise, I couldn't stand up. I couldn't sit up. I have to relearn and redo all these multiple exercises over and over again to strengthen the muscles. I was discharged on 6th of October. Oh, I was quite happy, but also a bit worried because my husband was serving isolation order. So he actually couldn't fetch me because my son was discharged. He's already no longer infectious. My husband arranged for him to take Grab to fetch me from the hospital. It's very nice to see a familiar face. Let's see. Everybody, egg tart time. Before the vaccination, we would have taken all the other precautions, like we don't eat out, we don't go out unnecessarily. But it's nice, we have steamboat at home. That's where I pick up things like making egg tarts, baking brownies so we can celebrate birthdays at home with my own cakes. The worst thing is not about ourselves, it's about the mental stress given to the family members. The other thing that you will feel is maybe guilt if you pass on the virus to your family. They have to take care of whatever that you left off. My husband have to take care of the household chores, have to take care of the children, have to take care of the bills. And that's on top of worrying about my condition. So it's very, very stressful. Actually, I don't do a lot of things nowadays because my husband is very worried. If I can, I have the energy, I will do some household work like vacuuming the floor. The fact that I have this second chance in life is a blessing in itself.
Singapore cannot stay locked down and closed off indefinitely. It would not work, and it would be very costly. Each time we tighten up, businesses are further disrupted. Therefore, we concluded a few months ago that a zero COVID strategy was no longer feasible. So we changed strategy to living with COVID-19. Living with COVID-19 has not been a smooth and easy journey.
I mean, last time this is my old store. Then we opened at 2018, March, somewhere there, March 5th. Yeah. Last time the business was not like this one. It was very roaring one. It's like we can queue right from here all the way to end, but sometimes they queue all the way back. Every bloody business, right? It's like damn crazy. I used to be a hawker at 2018. Then I moved here 1 year ago. So hawker for 3 years, restaurant owner, come cook, come whatever that you want me to be for 1 year. Start of year was actually okay, manageable. We still can afford salary and all. But apparently the cases just fluctuate up and down, up and down. Business it went up. After the first heightened alert, everything went up. But after the second alert, right, everything just went down and never came back. When COVID still hit, I was still a hawker, but I was already very affected already because our hawker center is at CBD area.
We will therefore impose significantly stricter measures. This is like a circuit breaker.
Our business will drop by 95%. Okay, let's say one day my sales can hit 600 because we just do lunch only lah. I believe that if a lot of people hear us 600 is not a lot, but we just do lunch 600 for hawker. I think it's a lot. But during that time, right, we can only hit like $6. We can only sell one bowl for a whole day, and that's how bad it is. Heightened Alert 1, right, we were really doing very good without restriction because we were a 42-seater restaurant. We could go for up to 42-seater and then we could have a turnover of 2 rounds. Then the whole day would be good for us to feed our salary, feed our family here and there. Then Heightened Alert 1 kick in. Then the business dropped very drastic, around 50%, which we think is very scary already. Then later when it start picking up, slowly people start to adapt that, oh okay, this one is COVID. Then they start to come out more, Heightened Alert to come out. Wow, and then the sales drop at 80%.
Today dish will be broccoli.
Someone should have a breaking point. Some days where your sales is zero, you will definitely have a breaking point. You will feel like, okay, maybe I should just forsake my deposit, then make a back seat, come part-time, then restart.
Like and share. First item.
Okay, after Heightened Alert 1, everybody chong out. But after Heightened Alert 2, right, nobody chong. Everybody just stay at home, right? That's why it's very unexpected. Like, every change, you cannot predict. Yeah, over at the front part, right, it used to be a plant-based, it looks like a jungle place. Then we remove it to sell merchandise, and then now we make this into a butler coffee for service provider. Because for the past 1 year, people always want coffee. Right now, there are co sharing a space. Like in the morning, right, they will do coffee. Then brunch onwards, then we can co-share the space and earn some money together. Lighten the load. The vision I see, right, is the one that stopped me from giving up this business. I still see the business as a growing business. We are more focused on being community. End of the day, we still want our customer to come in and recognize us, talk to us like a friend. I'm starting to see Bay Home Cooks going towards the right direction that I set 3 years ago already. There's a hope for now. I'll be even more reckless and even more ambitious.
How are you today?
I'm actually feeling slightly better as to when I saw you on Monday.
When there was a call for GPs and family physicians to step up to provide home care for patients who are recovering from COVID infections, I took on the role of providing telemedicine consultations to take care of patients that I've diagnosed with COVID illness. Okay, so if there's anything else you need, you just let me know. All right, we can arrange.
Okay, sure.
Okay,
yeah.
so we'll deliver the medicines to you also. You should be getting it soon.
Yeah.
I've never expected that in my life I would go through 2 pandemics. It certainly showed me that we as humans, we are able to adapt despite the challenges that we have in this pandemic. We work to make sure that our social life, our social activities are not curbed by it, and we are able to continue with our life. I treasure the time that I have with my family, especially in between clinical sessions in the morning and night. In the afternoons, I spend a lot of time with my wife and my son. So we spend time having meals, watching television, playing games and sports. I think the virus is here to stay. infections will still continue, but I believe that with good vaccines and treatment modalities, we will soon be able to relegate this virus to become a normal flu virus.
We should really just move forward as a nation. I'm not complaining about the government. I'm happy at what the government is doing, keeping us safe. But maybe we should just take a step forward and roll the dice and be brave.
Rather than trying to turn back the clock and say I should have gotten vaccinated earlier, I want to move ahead and tell people what I have learned so they don't have to go through all those things.
COVID has surprised us many times before and may yet surprise us again. But get there, we will. In a safe and careful manner, with no one left behind to fend for themselves, and with as few casualties as possible along the way.